Could I have still been in active phase when I had decompression surgery for thyroid eye disease? I had been having problems with one of my eyes for about a year. It looked and felt different. I felt it was blinking slower, dry, and painful. After numerous doctors, I was referred to an ophthalmic plastic surgeon, was diagnosed with thyroid eye disease early 2014, had decompression surgery December 2014, fat removal. I hated the way I looked afterwards, so I had eyelid surgery in 2016. I am still having problems with my eyes, and I hate the way they look. I am looking at another decompression surgery, but wanted to hear another doctor's thoughts.
Thank you for your question. You submitted your question with two photos, and you describe in your question that you had issues with discomfort in one eye, and that in 2014 you were diagnosed with thyroid eye disease, and you underwent a fat removal orbital decompression surgery by an oculoplastic surgeon at the time. You still felt concerned about the appearance of the eyes, and so you underwent eyelid surgery in 2016. Now, currently, you state from your question that you hate the appearance of your eyes and you're considering another decompression surgery, and you're looking for additional opinions based on photos that you've submitted. Well, I can certainly share with you my approach to dealing with patients with thyroid eye disease. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Thyroid eye disease has been a very big part of my practice, and I perform the full gamut of procedures, everything from orbital decompression to eyelid surgery. And I can certainly understand the challenges that you're dealing with in terms of your desire to improve your appearance. So, to begin with, I think that one thing you could be sure of is that if you've been going to an oculoplastic surgeon who has been doing the work in a stepwise way, I think your doctor will be the best person to guide you as to what next steps are. And I'll explain a little bit further. When we think from the term, the concept of what happens with thyroid eye disease, and understanding that there are two phases. There's the active inflammatory phase, and then there's the fibrotic phase. And generally speaking, you try to avoid operating during the inflammatory phase unless there is a very clear indication, such as visual threatening disease, that requires surgical intervention at that time. Now, typically, the active inflammatory stage, where there's this autoimmune process and variability of the eye appearance, you can expect that on average can last about 2 years. In the medical literature, it can last up to 5 years, but that's really on the rare instances. Basically, determining whether someone is in the fibrotic stage is contingent mostly on clinical appearance, based on the stability of the eye appearance, and of course from that point you do surgeries to help people improve their eye function and eye appearance. So with the fat decompression, it was likely done because you had an issue with the proptosis, or the prominence of the eye being pushed forward. And that approach can be very effective in reducing the volume that is behind the eye, since in thyroid eye disease there is an increase in certain types of thyroid eye disease proportionally in the amount of fat behind the eye. Now, the question at this point is what do you want to see change? If you want to see projection of the eyes change, well, I think it's important you discuss with your doctor what are your other options. It is likely your doctor probably did as much fat decompression as is safely possible from your initial surgery, which leaves you with the procedure called bony orbital decompression. And in bony orbital decompression, you're actually removing parts of the bone in the orbit, such as the bones in front of what's called the ethmoid sinus, above the maxillary sinus, and even further you can actually reduce the bone in the lateral part of the orbit or the greater wing of the sphenoid. This is more technical jargon, but it basically means that you are doing a more aggressive operation, and with that comes certain risks that you need to be aware of. Now, if you're more concerned about the appearance of the eyes in terms of the retraction, well, I think that it is likely you can do additional eyelid surgery which can address the eyelid retraction. This includes surgery to address lower eyelid retraction as well as upper eyelid retraction. Now, you mentioned that you did have this surgery, or eyelid surgery, but you weren't exactly specific. But nonetheless, as long as you have an understanding as to the risks and benefits, I would probably say, coming from a more conservative perspective, that and again, without a physical examination, but at least understanding how I counsel my patients, I ask them, how much does the prominence of the eyes bother you? And very often, if I show them that the eyelid being brought down from the upper, let's say in the case of the upper eyelid, and brought down a little bit, it's remarkable how it can really change the perception of prominence. Basically, if eyelids are retracted, the eyeball looks more prominent. And so it's basically both an optical illusion, but at the same time, it is also functionally more comfortable for the patient to be able to comfortably close their eyes. You know, with fat decompression, I've observed that even if you don't get that much of a retrusion of the eyeball does move a little bit more easily, and the blinking actually becomes more comfortable. Again, this is clinical experience, but I think that when I present a lot of my patients what their options are, they tend to shy away from bony orbital decompression because of the extent of the procedure. That's not saying it's not a good procedure. It's actually a very effective procedure, but I think it's best reserved for more severe cases of proptosis. So that being said, I think it's very important you speak to your oculoplastic surgeon about your situation. What differentiates your doctor's perspective from someone else's is their familiarity with your anatomy. Now, certainly as a specialist and as someone who sees patients and takes care of patients from around the world, I have been in a position to do revision eyelid surgery, whether it's for eyelid retraction or eyelid ptosis and other eyelid situations. Certainly it's okay to have other opinions and have at least an understanding, but I think that you should have this discussion first with the surgeon who has done the surgery for you already. Now, if they feel that they've done as much as they could and they don't want to do anything more, then seek additional opinions. But in the meantime, I think that it is important for you to understand and have this discussion about bony decompression versus additional eyelid surgery. And although there's no examination here, I suspect, based on your photos, that you might find a middle ground of compromise and with the eyelid surgery over the decompression. I think one of the things that I've counseled my patients who have thyroid eye disease, which very often affects young to middle-aged women, in that and the significant impact of this disease on their physical appearance can be quite devastating and very emotionally impactful. And so understanding that it is accepting a change that is very difficult to restore to the pre-thyroid disease appearance, but nonetheless have a natural aesthetic appearance is possible. And that I think is important to at least just get comfortable with. It's never ideal, but it is unfortunately just the physical realities of these long-term anatomic changes from this autoimmune disease. So I hope that was helpful. I wish you the best of luck. And thank you for your question.